Hey everyone, this is Dr. Chellam. Welcome to Women Wired for Wellness. In today's podcast, we're going to be talking to Dr. Antione, who has a very amazing journey, not only through her own autoimmune condition, but her husband's malignant brain tumor, her kids' psychological and brain issues, all of which would have made a traditional person to have just quit, given up, and live in a world of self-pity. It's amazing her journey where she walks through each of this, figures things out, and is here to teach us on how to approach whenever you get catastrophic diagnosis. What are the steps you need to take in order to not only protect your own health and sanity, but that of your families? And I'm sure many of you who have kids who've struggled with whether it be psychological issues or behavioral issues have always struggled to find a different approach than what traditional medicine has to offer. Traditional medicine has its own place in our health or disease management journey, but to really recoup health, a lot of times we have to ask the right questions. Hopefully this conversation with Dr. Antione will help you understand that even as physicians, we struggle with a similar journey as patients do in the medical system. And these conversations help you understand how to think differently and how to stand up for yourself and how to get the right kind of treatment that will get you towards health and wellness rather than just be stuck with disease management. And here's what I would say. Despite all of this that I put out there, I still find people saying, I have 5 autoimmune conditions. I can't do this. I can't go there. I can function normally. And I want you to understand, you don't have to live with disease if you're willing to do something different. Hopefully this conversation will help you understand that there's always a way. And without any further delay, here's my conversation with Dr. Antione. Welcome everyone. I'm Dr. Chellam, your host for Women Wired for Wellness. And today, as I mentioned, I have a very good friend and somebody who has a very inspiring story, Dr. Antione. And welcome. And thank you so much for being on our podcast.
Well, thank you for having me. I'm so glad to be here.
So, like I spoke to you, Ellen, before, one of the reasons I wanted to talk to you is you have the most inspiring story I've ever heard. Like most functional medical doctors do get into functional medicine because of their own personal journey. But it's almost like a crisis, a catastrophic crisis that got you into a different path. So what I really want people to, and really go walk through your journey with you. Yeah. So if you could just tell us your training, your background, and what took you, what did it take for you to think a little different and become what we call a functional medical physician?
Absolutely. Thanks again for having me. So I started my career as an emergency medicine physician. I'm board certified. I loved it. I loved practicing in the ER. I thought I was going to do it for forever. But in 2004, my husband, Scott, was diagnosed with a malignant brain tumor, and he was given 2 to 5 years to live. And as you can imagine, your world kind of blows up when something like that happens. And I stopped working in the ER because I fully anticipated, again, being a physician, knowing the likelihood that he would survive is very small. I wanted to be home with him as long as I could. And at the time I happened to be pregnant with our 5th child. So as you can imagine, even more overwhelming. I always like to stop here and say, my husband is doing great, because sometimes people start to go, oh goodness, her husband died. He did not. And that truly is a miracle. And I also want to say the reason he's here is not about functional medicine. Yeah. I'm a deeply spiritual person, and I feel really strongly that it was a miraculous healing because we didn't know functional medicine at the time. But again, we didn't know that right away. So here I am, this ER doc. I stopped working. I believe my husband's going to die. I have my 5th child. So I have 5 kids, ages 5 and under, and I'm home. And all of a sudden, I didn't feel well myself. I started to get joint pain. I was really tired, and I knew something was wrong. And I ended up going to the doctor and was diagnosed with something called lupus, which I know you know, but your listeners might not. That is an autoimmune condition where the body's attacking itself. So I saw a specialist, a rheumatologist, who told me to go on steroids and immune suppressive medications. And as an ER doc, I always see the catastrophes from those medications. So I didn't want to go on them. It wasn't like I had some other alternative. I didn't know functional medicine. I didn't even know an alternative existed. I just knew I didn't want to end up on steroids and immune suppressive medication. So to be honest with you, I was so overwhelmed with my husband and my kids that I kind of ignored my own health. And over the next 2.5 years, my numbers and symptoms started to worsen, but 4 of my 5 children started to have some significant health issues. My oldest was really struggling in school. The first person we took him to told us that he was on the spectrum for autism. And Scott and I just didn't feel like that made sense. So we decided to take him somewhere else. Of course, that person said we should medicate him so he would behave in school. The next person said he's got ADHD and we should medicate him so that he behaves in school. And again, we didn't feel like that really fit the clinical picture we were seeing at home. And so we waited about a year to take him into a developmental specialist who then told us, and mind you, my son's not even 8 years old at this point, who then told us that he was psychotic and schizophrenic. And you can't even make those diagnoses in anybody younger than 18. So as a physician, I was really angry. And as a mom, really worried. Here we are being given this diagnosis. So that was really overwhelming. But if you can believe it, my other 2 younger kids, twins, 2.5 years younger, were really struggling with learning disabilities. So they were being pulled out of class for specialized speech and tutoring. And then my 4th had severe ADHD. He was in kindergarten. He could not sit at the dinner table, let alone sit through kindergarten. So we did medicate him because, again, traditionally trained doctors were said, he's got ADHD. That's obvious. Let's medicate him. And within 2 weeks, he threatened to jump out of his own bedroom window. And
on medicine, you mean?
From the medication, he became suicidal. So, of course, I said, oh, I'd rather have a bouncing around child than no child. So we stopped that medication, and then Scott was diagnosed with epilepsy as a result of his brain tumor. So when you ask me, talk about my journey and going from traditional medicine world, I love traditional medicine. I think there's such value there, but the recommendations and approach was really not making sense to me. Here, let's throw everybody in your family basically on a bunch of medications without understanding why. And I guess part of me as an ER doc was always, medical detective work, right? If somebody came in unconscious, my job was to figure out why. So I like that piece of it, but I was really frustrated as the patient now, not as the doctor, sitting on the other side of being just what I felt like was on the other side of a prescription pad. And that was what led me to say there has to be something different. So I got on the computer.
Yeah, but before you get there, I really want to unpack that part of it.
Yes.
So when Scott gets diagnosed with a malignant tumor and you're given 2 to 5 years, I know you always say it was a miraculous recovery. As this was happening, you were having issues with your kids too. Was there anything else that you did for Scott? Did he undergo any of the treatments, the chemo, radiation?
So it's a big, long, amazing God story that I'm happy to share with you. No, and not because of by choice. He was scheduled he had his first seizure and was diagnosed February 1st, 2004. He was scheduled for surgery February 12th. He was in the military at the time, so we needed to go to a special doctor who saw him in the military system and did a massive workup. He got a PET scan, he got lumbar puncture, he got everything known to man. And on February 11th, they shaved his head, and the physician called his cell phone at 7:30 at night while we were eating dinner and said, I'm not going to operate tomorrow. The only medication that he was on was seizure medicine because he, had a seizure. So we went to the doctor's office instead of going to surgery the next morning. The doctor said, I feel uneasy about doing surgery. I don't know why, but I want to wait 5 or 6 weeks and bring you back and do surgery then. And his tumor was the size of a walnut originally. When we went back in 5 or 6 weeks, it had shrunk to about the size of a quarter. And over the next year, it went from a quarter to a nickel to, a pencil eraser. He has a small little dot, but he never got surgery, never got radiation. We never changed diet. The only medication he took was seizure medicine. And that's why I say it was a miracle, because it just was.
Wow. And that physician had never seen something like that before as a neurosurgeon.
Never seen anything like it. And the physician, there's so many details in there that I could go into, but I won't. But I was very angry he wasn't going to operate, because I didn't want to go home with my husband having a brain tumor, but he refused. And he just said, I don't feel good about doing it. I'm uneasy.
And you didn't think about going to another doctor?
We were not allowed. We actually were supposed to go to Sloan Kettering, but the military made him go to Walter Reed. And I'm thankful that we did, because he would have been operated on, and we never would have seen that miracle.
Yeah. That's amazing. All right. And then to get back to your, your own, so your health is deteriorating. You have your kids having their own issues. So it's pretty much like, how do you live life through all of this? Like, what is it, because you're like got the foot on the gas pedal? Because this is the point at which people give up.
Yeah, I think probably, to be honest with you, being an ER doc and always being in overdrive from not saying that's the best way to live, but I've always been a pull yourself up by your bootstraps kind of person. But my own health was neglected and avoided during this time, because I was so overwhelmed with my kids and my husband that it took for me to get to that place where I really was, I can't go on. I can't do this. I have to do something else. And being a mom with kids that are struggling, that's usually, we'll put our own health on the back burner,
So I think I want the listeners to listen to that. This is what happens to moms, even if you're physicians, even as much as we tell our patients, like, you need to put yourself, it's the most selfless act is to be selfish.
Right.
And the reason you would be selfish is so you are not a burden to the people whom you love. Right. So at that point, you just felt like, I have to do other things are priority, and you took care of your kids. So how did you get to resolve? Look like your kids had probably the same issues. All of them were brain issues. Mm-hmm. So how do you walk through that? And yours was an autoimmune condition. Right. And so it looked like Scott was the most healthy amongst you all in all of this.
Yeah, brain tumor and all, but he really wasn't. That's the thing. Functional integrative medicine has absolutely made my husband a healthier person. He was, somewhat, had some extra weight he was carrying. He felt inflamed. He was kind of brain fog. He wouldn't have said it at the time, because that's your norm. But looking back, we can say, oh my goodness, I was so unhealthy at the time. But yeah, I think that you hit rock bottom, and it was there that I said, something's has to give. There has to be some answers. And that's when I started getting on the computer and I started typing in alternative therapies, and functional medicine came up, and it made sense to me. Like, finding out the root cause of what's going on, I think it also gave me, like, if there's nothing else I can do, I can at least work on that, because I felt frustrated that nothing I could do. I didn't know anything about changing diet. I thought I was healthy. We ate whole grains and fresh fruit, and we weren't McDonald's eating family. We were relatively healthy, but we were the sickest healthy people I knew. So, finding functional medicine and really dedicating my time to learning so that I could help heal my family was what I did over the next several years. So that was what it was for me. My kids were continuing to deteriorate, and I felt really hopeless and overwhelmed and needed to find some answers. And I didn't know any physicians that did this. So it was myself. I had to go be my own advocate. And I will say what you said before about being a mom, that's why we say put the oxygen on yourself first, because you also, not just being a burden, but you also can't take care of your family if you're not healthy. It's so important.
And it's very interesting as a physician too, as much as we tell our patients, don't go online on Google and try to get yourself confused, but that's what we did too. I remember doing the same thing. I used to tell my husband, it's like, I feel like I'm watching porn because I'm at 2 a.m. sitting and looking at that. For me, it was like I have to practice differently because I was so tired of seeing sick patients whom I could never get better. And I think that's very important. So now you've found functional medicine. So if somebody were to understand, because this is very confusing for folks, right? I want holistic healthcare. I want integrative. I want functional. What do all these mean? And why was functional medicine, more attractive to you? I know you said getting to the root cause, but that's what integrative doctors would say and holistic practitioners would say. So the way I look at it as holistic is you're putting the mind, body, and spirit together, and anybody can be a holistic practitioner. Somebody who's trained in a religion can be a holistic practitioner. Whereas integrative is you're integrating other modalities with a traditional treatment. So I want to treat pain, I'm going to give you some pain medicine, but I'm going to add acupuncture and massage therapy to it. And for me, functional medicine is like asking those two questions. Why is this person not healing? What do they need? What do I need to give them? Or what do they need to get? Or what do they need to remove? It's very simple. So if I can find the answers, my detective work is to find the answers to those two questions. I usually can put them in the right trajectory. What would you say for you? What was your attraction to functional medicine?
Well, I think the same thing, and I'm a really visual person, so I often am describing to my patients what I believe I do marries the best of kind of both worlds. And I think medicine practiced with functional medicine, traditional medicine, integrative medicine, holistic, all together kind of in one married person, to me, is the most comprehensive medical care. And so the visual that I give my patients is I always tell people, envision your body as if you're this beautiful flower in a flower pot. And you're blooming, and you take your watering can, you water your plant, it absorbs the water it needs, and out through the bottom of the hole of the flower pot, with excess water drains. And I always tell patients when they come to me, they often describe feeling over it. I'm so over it. I'm over feeling this way. I'm over having lupus. I'm over my kids, or I'm over a cancer diagnosis. And I always laugh because I believe that kind of over it describes what we're talking about. The body is overloaded, overwhelmed, overflowing, and I'll talk about oversimplified. So if we take that flower pot analogy, instead of a watering can, we've got a fire hose. We are overloaded with spiritual issues, so that hose represents sort of the external stressors to the body. So we've got food, we've got toxins, we've got relationships, we've got spiritual issues, all of these things that can either be watering and nurturing to the body, or can be this overload. And most of us are dealing with an overload. And then the body, if you imagine a fire hose to a flower pot, it gets overwhelmed, right? So a fire hose is going to overwhelm this body, like our own bodies. We get overwhelmed, and then we have a puddle on the floor, which is the overflow. And that's why I'm tired. I have high blood pressure. I have autoimmune disease. I have joint pain. I have whatever it may be. And so we've overflowed. And I say traditional medicine oversimplifies. We take a mop and we mop up the floor. And if you think about that picture, we've got a hose that's on. We've got this body that's overwhelmed. We have a puddle on the floor, and if all we do is mop up the floor, it's as if we've got our sink that's overflowing in our kitchen, and we pull out the mop, but we don't turn the faucet off. We don't pull the drain up in the bottom. And so, functional integrative medicine to me is looking at all of those. Yeah. How do we identify what the hose is? How do we reduce it and turn that hose down? How do we identify what's in the body and why it's overwhelmed? And how do we reduce what's overwhelming the body? And those holes in the bottom of the flower pot, to me, are the detox pathways that we were born with. How do we optimize that and sort of drain the overwhelm in the body while we're structurally supporting the body? And that way we're not just mopping up the floor. So to me, when I looked at functional medicine, what attracted me was, the approach I was given, and I'm not anti-medicine. Like I tell people, I joke, I've been hypothyroid since I'm 19 years old, and thyroid medication is a mop. But I tell people my mop is in a mop closet. Like I don't have an ongoing puddle. So I'm not anti-traditional medicine. There's the best of both worlds. But we have to look at it from my perspective, being a visual person. I want to make sure I'm turning the hose down, making sure I know what's coming out of the hose. I know what it is, and that I'm addressing it and not just mopping up the floor.
Got it. Yeah. So really for like once you discovered functional medicine, what was the journey to get your family back on track? What were your aha moments? Because I think people don't realize, and I think we spoke about it just before we started recording, is where patients get frustrated going to in and out of the medical system. Like when they say, I'm over having lupus, they come to you about 5 years of having lupus, seeing different rheumatologists or different primary care doctors or different even holistic practitioners, taking, if one person gives medication, the other person gives supplements, but still their symptoms are not gone. They're just getting worse, or they get slight improvement and then it gets worse. So for that kind of a patient who's so frustrated by all the options that they have, but nothing seems to work, what makes this approach where you're integrating, you're being holistic and having a functional medicine approach, what makes it different?
So, to kind of stand up for our colleagues a little bit, I would say you and I, we were trained traditionally. We don't know that there's this other world out there. I didn't know anything about it. And so I hate to I look back and I think I was really upset with the doctors, but I realized they were doing the best that they knew how to do.
Exactly.
They didn't have the time and training that I've dedicated and you've dedicated to learning this, because it is additional and separate training from the traditional medicine world, which I don't think it should be, but it is currently. And so, doctors are doing what they think is the best approach. But again, we're so focused on the mop that we're neglecting the rest of what's going on in that picture. So, I developed this process that I call fully functional through my own process. It's this 5 steps of identifying, reducing, optimizing, supporting, and personalizing. And then, for my own family, I had to go, I didn't know what I was doing. I was sort of floundering my way through this. And again, because I didn't know anybody who did this type of medicine. So I think from a patient perspective, you need to find someone who has been, through training. Not a weekend course, right? You need to find a doctor who's been through training, who's spent hours doing this, who has come up and has, the tried and true, approach that works for them and has worked for hundreds, maybe thousands of patients at this point. And for me, it's that, in my own family, we identified that gluten and dairy was an issue. We were eating, I was on a, whole grain diet, but it was lots of gluten containing stuff and lots of dairy, because those were good for you things. So we identified some gluten and dairy issues. We also identified some genetic variants that impact the way we detox. So we were not good detoxifiers. That's why it impacted us from brain health to immune dysfunction and all sorts of things differently. So we identified those. So reducing for us meant we had to pull out the things that were inflammatory, like gluten and dairy. I had to start looking around my home and going, I probably shouldn't spray Roundup on the weeds out here. These are things I didn't know. I probably should use this cleaning supply rather than something else. And, that third step that I talk about, optimizing detoxification, we are all detoxifiers. We urinate, we have bowel movements, we sweat, we exhale. I call sleeping and dreaming a mental detox. There's liver detox, lymphatics. But I don't know about you. I wasn't hydrating. I was a mom of 5 kids, ER doc. I did not want to be in the bathroom, so I didn't hydrate. I never slept. I was always told moving your bowels once a week was normal for you. All these things that, again, you look back at your training and you're like, gosh, boy, how could you tell me that in medical school and everything else? And how could other doctors believe that? It's fascinating. But, so for us, the aha moments were with these little nuggets. And I'm like, oh my goodness, if we just do this, okay. And so, I will tell you, long story short, because I didn't give you the positive here. Obviously, I told you about my husband. He hasn't had any evidence of brain tumor except for that little dot and no seizure. February 1st will be 17 years.
Wow.
So love that. I saw that rheumatologist for 5 years. My numbers got worse. I finally quit going. And as a traditionally trained doc, I thought I'd always have markers for lupus, so I didn't think it would go away because it's not known to be reversible. I have no evidence of that. My oldest son is a senior in college. Nobody would ever say he's psychotic, schizophrenic, ADHD, or on the spectrum. Twins that just got Dean's List their freshman semester in college.
Wow.
So no learning disabilities. My fourth absolutely has attention issues if he doesn't eat right, but he's got a 4.5 grade point average as a senior in high school, not on medication. So I think we're doing quite well. My fifth never had any issues, but I think the moments for me were actually just understanding the body better, as a whole. That's part of this training in functional medicine. When you go through medical school, you're looking at each individual cardiology and GI tract and neurology and dermatology and whatever it may be, your hormones. And we don't put the body together. The body's this amazing thing that, all functions together, like, roots of a tree. Everything's connected.
So it's very integrated, and nothing works independent of the other. But I don't think that's how we are taught in the classic medical school. And patients believe that too, right? And a lot of times when you talk to people, like if you had lupus, you would just walk around saying, I'm a lupus patient. So disease becomes a patient's identity. Absolutely. And we don't think of health as an identity. Right? We identify patients by their disease. Did you see the stroke patient in room 203? Right? We don't look at them as human beings. So the whole, I almost feel like the medical system has to be burned down to the ashes and rebuilt. And you need to have a wellness track and a disease management track, and patients need to know which doctor to go to for what questions. Because I think this frustration and confusion for us is we don't have answers if you just know only the traditional medicine, because truly we are taught how to identify disease in the early stages, how to suppress it if possible so that it doesn't progress at the same rate and kill the person. I mean, you will die 10 years later with a heart disease. At least I gave you 10 years extra with those medications. Right. And patients now, because of this abundance of information, come to a doctor hoping like, oh, I'm going in with diabetes or hypertension. I want this to go away naturally, because they know that option is there, but they don't know who to look for. They go to their regular doctor and get frustrated. It's like going to the wrong specialist for a problem. So how does a patient really identify? I think for me, this is where I tell patients, for you, health has to be your identity. It has to be something you actually want. I worked at the VA, and I remember when I first got introduced to lifestyle medicine, I remember I was, when you learn something new, you want to immediately spread it. What do they call it? The Kruger-Dunning effect, like everything about it and you want to just immediately share it with the patient. I remember sitting in front of this patient and saying, you know what? Cholesterol, we can actually get your cholesterol down. I can give you the lifestyle measures, or I can give you a pill. He looks at me and he says, doc, I love enjoying life. Just give me the damn pill. Right? So it's almost like I'm like, nobody really wants it. That's how I used to think about it, but there's a different approach. So what do you tell patients? Like when they call you and say, so what do you do? How is it going to be different for me? To me, I think going to a functional medical doctor is an experience. Right. It's not like an appointment. It's not like that traditional so-called on paper 15-minute, but actual 7-minute appointment with your doctor. Right. So how would you explain that to a patient? I know I get long-winded with my questions, but you get the point.
No, it's great. I would say, just before we go into that, the mindset piece is such an important piece. So I want your listeners to understand that, because I do think we do walk around as the patient saying things like, I'm a lupus patient, I'm a cancer patient.
Right. Cancer survivor.
It's right. It's so important. I just want people to hear that if they're doing that right now themselves, they need to change that own internal language to I'm a cancer fighter, or I'm a cancer survivor, instead of I'm a cancer patient, or I'm a lupus patient, because it actually really changes brain chemistry. And so one of the things, when we talk, a lot of times people are seeking me out because they went online. So a lot of times people, we don't do a lot of marketing and a lot of reaching out to people. They often find us through word of mouth, or because they heard about functional medicine, or they're looking for alternative therapies. So a lot of times I think, I'm not having to do a lot of convincing necessarily when people are reaching out to me. But I do think that explaining to people the process that I just mentioned to you, because it's, if I'm not going to be a good fit for somebody if they just want to have a quick fix. And I'll tell people that I use a fire hose. I'm a real visual person, so I tell people things visually a lot of times. Sometimes people come to me in crisis, and I describe it like we're a house on fire. Okay, so if you've got a cancer diagnosis, or you're really, in pain, or something serious is going on, the fire hose also can represent traditional medicine approach, and sometimes it's appropriate, right? We've got to put that fire out, because what I do from a functional integrative medicine standpoint is my approach is really dealing with smoldering coals underneath, right? I'm dealing with all the things that start the fire or perpetuate illness long term. But, I'm not anti-fire hose, but if we're going to take that approach, then there's collateral damage, right? If we take a traditional medicine approach, let's say there's a cancer patient, they decide they want chemo. Yes, it might address the chemo, but now we have all this collateral damage. So what I explain to people is that people who come to see me are not going to get better, like they have a sinus infection and they take a pill, or they take a supplement even, and they're going to be better in 24 hours, 48 hours. It doesn't work like that. It is an approach where we'll put the fire out if we have to, but it's a longer approach dealing with smoldering coals underneath. And it's going through those 5 steps that I just talked about that are really essential. And so they have to want that, because I consider it a journey. This is not a typical doctor-patient relationship where I write you a script, even if it's a more holistic script where I say, here are your supplements, or here's your whatever. It's a partnership together. I can't walk someone up the mountain, but I also don't expect them to do it on their own. So there is this partnership that goes together. So I think what I tell people is, if you are looking for something different and you are invested in trying to get the answers and really personalizing this process for yourself, so at the other side of it is you can navigate your health journey in the future. That's my goal, is that people don't need me for forever, then it's the right place to be. But they have to be willing to put the work in. And I will tell you, some people, like your patient, are either invested sometimes in being sick, and having that has become their identity, and they don't know how to live in another way. So you have to want to not have that identity, and you have to want to, even if you're tired, even if you're really sick, we can help you, but you've got to understand that there's your own personal investment. And so to me, that it's really partnering with people, and that it's time. And you can't do this in a 6 or 7 minute appointment. It's impossible. And they need to see someone who really does have that background education that's not typically found in the traditional medicine office. That someone's going to look different. They're going to look for things differently.
Right. And I think that's because you're in Indiana, I'm in Michigan, and I don't know if Indiana is as heavily insured as Michigan. Michigan is all about insurance, right? And insurance has never supported a functional medical approach, except for probably a lifestyle approach like de-nourishers, I think, is covered by Medicare. But again, they need about 7 staff you need to hire. And that's a problem, right? When people don't realize having health insurance is having disease management. So that's why they get very frustrated as they do that. They say, something is covered by my insurance. Your insurance was always created to help you through catastrophic health issues, so that you don't get bankrupt just because you had a stroke or a cancer, and it will cover 80% of those expenses.
Right.
And I think when it comes to chronically being sick and losing your health, your complete approach, your thought process, your mindset, the person you talk to has to be looking for different things, because the same traditional thinking is not going to get you any better. The same traditional thinking is going to get you more medications to manage more symptoms. So for a patient who is now found you or me or one of the functional medical doctors, what should they be actually looking for? What are the questions they should be asking a doctor?
So I want to say one more comment on that, because I do think it is a change in perspective. People have to look at this as an investment, because it's, different practitioners do things differently. Some will submit some things other ways. Most of this care is not covered by insurance, as we talked about. But I find it fascinating that people have no problem buying a $1,200 iPhone. But they're sick and they really, struggle with spending $1,200, if that's what it is, on their own health. And I think we have to educate, that perspective. Yes, you can continue to be in the insurance model, but you're paying for sick care. You're not paying for well care. You're not paying for health. You're paying for that catastrophic stuff that should be there, but that is not set up to get you to your healthiest state. So I think priorities do need to be looked at, and that has to be part of it. So, what are the important questions to ask? I think before you even go to see somebody, I think it needs to resonate with you. So yeah. I always suggest going to that person's website, right? If what they say online resonates with you, does that approach, everybody has a bit of, you and I don't, do things exactly the same. We have a bit of a different approach, and that's what which is great, because we're human beings and individuals. But I think you have to ask yourself, what are you prepared to do? What is the type of investment you want to make in yourself? Who is that person? One, I would look for a certified functional medicine doctor. So somebody who's gone through the training, usually on Institute for Functional Medicine has a good list of physicians that are certified, so they can start there. So I would look for somebody who truly has training, because a lot of people will say, I'm a functional medicine person, and they haven't gone through that training. So I think that's really important. Educate yourself first. Get, if there are friends or local people that have been there, kind of get that experience. And then I would, ask yourself what's really involved. When you call the office to make an appointment, I would get, are there going to be dietary changes, lifestyle changes? Find out before you even, what is the approach that doctor has. And, if the approach, somebody may love a paleo diet and somebody else may love a vegan diet. If you're a vegan, you're probably not going to want to go to the paleo, the doctor that supports or promotes a paleo approach. Ideally people work with individuals and they're able to tweak that a little bit, but I think you have to find out what you're willing to do, because one of the things that bothers me probably the most, and I don't want to take money from people if they're not invested to make the change. And so if they start the process and don't do it, it's frustrating for both people, them and us. So I think you have to just do a little deep dive into yourself. How prepared are you at least for me, it's a process. It's not a quick fix. So if they're willing to do that, dive in and want to know all the information and are excited to be educated and learn about their bodies, then I'm the right person. If they just want someone to tell them, here's what I need you to do, then, so those would be the things. I think it's more of a personal thing. But training and education to me would be the first thing I would look at before I went to see somebody.
So, here's the thing about you're going to somebody's website, you're going to look at how they approach. But a lot of our patients, I don't know if you get them, but I do get a lot of people who do their own research, right? Do it yourself. And all they want is like, can you just let me know if what I'm doing is right? And it almost feels like very simple. All I have to do, who doesn't know that you have to eat fruits and vegetables and exercise every day? I think we all know it. Right. What I think people don't realize is to actually do and get that result is not as simple as, what you said was very important in the process, the 5-step process. I want to clarify this thought. When somebody goes online, and like for instance, I had a call today somebody said, I have Hashimoto's, and I went online and they said something like a paleo diet works, so I'm trying to do that, right? That's their approach. But this is the analogy I use, and I'm sure you have a better visual analogy. It's like you're throwing stones at a car. because you just decide, you're angry, you're throwing stones, it's got all these dents, and suddenly one day you realize, you know what, I really like this car, it takes me to work, I'm not going to throw stones anymore, I'm going to take care of it. What really needs to happen, those dents are still there from the previous. So there is chaos in your body, and you're going and trying to just change your diet. And so you go off gluten, like you said, you saw you had a gluten issue and a dairy issue, go off. And I see people who come and tell me, I stopped my gluten and dairy, but it didn't make a difference. Right?
I have a visual for it.
Yeah. And so what do you tell those people who feel like this is so simple? This is something I can go online. I can go on to a paleo or a keto diet or a vegan diet, and I'm going to look fabulous, because there are, granted, there are so many physicians who've made a career about talking about diets. I mean, literally, their practice runs off a keto or fasting protocol or a vegan diet. I mean, I'm personally plant-based, but I never advertise it as such, because that suits me. Right. It's not what I think everybody who comes to me should be doing. Right. And I know that because I do genetics. And I think I've said that in the group, it's so powerful to see how somebody's wired, what their metabolics are, what their gut health is, string that together and create a personalized plan for them. But what would you tell a patient who says, all I need to do is to go to Google University, educate myself, and right. I fix myself.
So I have quite a few patients that, so I don't get a lot of people that come to me and say, I think I'm just going to go online and do this, because they've tried that and they come to me.
Yeah.
Mm-hmm. So I have a couple of different things that I describe to people. One of them is, I have a lot of people that say, I went gluten-free, I went dairy-free, it didn't work for me. So I don't want to do that. If that's part of your plan, I don't want to do that. And what I tell people is, imagine yourself sitting on a chair with 10 thumbtacks, okay? It hurts if you're sitting on a chair with 10 thumbtacks. If you remove 2 of them, gluten and dairy are your thumbtacks, it still hurts. You have 8 others. So it has to be this comprehensive approach: identify, reduce, optimize, support, and personalize. And if we're only targeting one thing, now diet does have a huge role. I don't think it's just 1/10 of something, but sometimes it can be 95% of something if they just change their diet. But often they don't see the results that they want to see, because they still have 8 or 9, even one. If let's say they removed 9 thumbtacks, it's still sitting on one that's hurting them. So I usually kind of tell people, over the next 6 weeks, it's like we're cleaning off the chair. We're giving you a clean chair to sit on. And then maybe some of those things that we removed were thumbtacks with no point on them. Maybe you can eat gluten in your future. Not my favorite thing, but maybe you can, because it wasn't causing you a problem. But right now I don't know that. So we've got to kind of clean off the chair, if you will. And so that's why a comprehensive approach. This is why I don't like, throwing one thing over here or giving one advice over here. We've got to look at the whole body, the whole picture, people's genetics, people's lifestyle, I can't tell a vegan to go start eat, animal protein. It's just not going to work, because that's so ingrained in what they believe. Even if I felt like it would be the best diet, I do recommend it. But if they're not willing to do that, we've got to come up with what is. But it's not one thing alone. And so again, I think people have to be, one, it is a partnership, but we also are the doctors with the training and can look at the whole picture and be able to say, look, you get to choose. You're an adult. You get to choose what you want, but this is my advice for you. And so anybody can go. I have to tell some people, and probably you do as well, please don't go on Google. Please don't do this to yourself, because they do get frustrated. I saw such and such thing, and should I do this? And I say, please stop. At least for the next 6 weeks, give me the opportunity to just do my thing together with you. Trust me. That's a big thing. If they don't have trust in their doctor, it's not going to work either. So, that's what I say. Use that visual. Imagine that. If it could be a supplement you take away or you try, or do, it could be anything you do or don't do that represents that thumbtack that the patient's sitting on. If they don't do all of it, it often won't feel like they're getting better.
Let me add, that is so true. I think what you're saying is so true about the fact that you have to take everything out, clean, and the way I visualize it, you want to paint the room. You got to take out all the old furniture, everything out of the room, clean it, tape it, paint it. But you can't bring back the old furniture. Sometimes you have to look and see, has the room changed? Is there something different I have to do? And that's what we get to do. But here's the part, I mean, I don't want to get onto my soapbox about this, but the testing, right? We get to do very different testing. One of the questions is like, so can I ask my doctor to do the testing? Right? That's a very common thing that they say. So why can't my doctor do the testing? What do you have to, how do you approach that? Because I've tried to explain to people the functional medical testing. I mean, the ones who sit with me and actually go through the testing. I today just now, one of my team members sent me a note saying, yesterday I was talking to a patient and his wife, and she texted her back saying, this has been life-changing, because the test results actually gave them some answers that they were looking for. So that's how I look at the test. But somebody who doesn't know what functional medicine is, how would you explain to them how our approach, what is the testing that we do that's different, and why they have to trust that this process is going to work?
Yeah, I mean, as you know, and just spoke about, the testing we have access to. I mean, I've access to hundreds of labs that I never had access to or didn't know about. And that's part of it is I do have people that say, why can't my regular doctor do this? Or the opposite happens. They come to see me, they get all the testing, and we go through it, and then they bring it to their doctor who goes, I don't know any of this. I don't know what any of it means. And so, you know, it's a totally different approach. In traditional medicine world, we're trying to get the quick answer. You know, we get the one piece of paper. I always hold it up and I tell people, this is what I used to do. I'd hold up the piece of paper and I'd look down at anything flagged as abnormal. No, good. Okay, put it down. And so, you know, we did our basic labs, thyroid, you know, a few thyroid labs, a cholesterol, a CBC, a metabolic panel, and you're done. Like, and if those look good, then there's nothing wrong with you. And it's psychiatric if all of those labs look good.
Especially if you're a woman.
Right. So then it's psychiatric. And so now, I mean, depending on the patient, I tailor my lab testing based on why people come to see me. And so I talk about that, you know, kind of deep dive into that, you know, flower pot analogy is identifying, and we're looking at hormones in a different way, not just the hormone numbers, but the way we metabolize hormones. And we're looking at hormones over the, you know, over the day or over the month, perhaps in particular patients. We're able to look at nutrients and get a much deeper dive into nutrient levels inside the cell, outside the cell, things called organic acids. We're able to look at gut health. You know, I remember doing stool testing in residency and very little in the ER, but like we'd look for parasites and that'd be it, you know, or we'd look for C. diff colitis and that'd be it. In stool testing, we get a lot more information about actual gut health and inflammation and immune markers. And then we can look at genetics and be able to look at the body comprehensively, look at cardiac markers, even thyroid, what I mentioned, you know, before where I'd get a TSH, maybe a T4 and say, call it a day, but that's not a comprehensive approach to looking at even the most basic of labs, thyroid numbers. So even labs that you can get through a traditional lab, we take a much more comprehensive approach to look for other aspects of thyroid and make sure we're looking at things like antibodies to make sure they don't have autoimmune disease. So, you know, I look for heavy metals. I see a lot of patients with tick-borne illness like Lyme disease and Bartonella and Babesia, and those labs can be, per the CDC, 50% accurate only. So I use specialty labs to get more accurate results. And I think I see people with, you know, mold-related illness that traditional medicine doctors know nothing about, so they would never. They don't exist apparently. A neurologist believe it. I have lots of examples of that in my own family with other things as well. So, you know, I think what you're getting into when you come to a functional medicine doctor is that you are looking for their expertise, but you really want somebody who has a wide base of knowledge as well as experience interpreting those labs, and to be able to tailor your specific approach to you for what your needs are and what you're looking for long term. And again, that's a discussion that doesn't happen in 6 minutes. It happens when you go through a history and I love what you talked about because it is life-changing. My follow-up appointments to review labs, I told you my 5th step is personalized. Personalizing a plan for my patients is important, but the most important thing is that the people personalize this process. And the only way you can personalize this for yourself is to know your body better. And if you don't understand your own physiology and you don't understand what the lab results mean, then you can't make those changes and personalize this. So I really look at myself as teacher, educator, and so we sit down together and review those labs. I use a lot of visuals because I like to do that apparently. But I like people to walk away from our appointment saying exactly like, wow, that was life-changing for me.
Yeah.
And then they're motivated also to make the changes because they understand it on paper and have had it explained to them in a way that makes sense, that they go, I never knew that about myself. I never knew that we could even look for these things. So it's really powerful when you can be able to have that experience together, doctor and patient together.
Absolutely. In fact, I think I had a physician who did the panel with me, and it's like a 1.5, 2 hour appointment, and I was explaining things, especially because she was a physician. I went into a little more depth. She says, your patients actually understand all these things. And I'm like, yeah, absolutely. If you use the right visuals and connect it to what they should be doing in life, it's very easy for them to say, I finally get it.
Right.
And I get to do something different. Yes. So, I want to respect your time. So as we wrap up, I want to ask you, what is a quick tip you would give to a patient who's just frustrated with their health issues and has not gotten any answers? What do you think they should do?
Well, the first thing I would say is to do some mindful breathing, to be honest with you, and some journaling. Those are 2 really powerful things to do. So I ask people to do 4-7-8 breathing. Okay, so take a breath. Because you're overwhelmed, you're stressed, and that's really hard on your adrenals, your own hormones, and you're not going to make great decisions when you're that stressed. So 4-7-8 breathing is breathe in for a count of 4, hold it for 7 seconds, breathe out slowly over 8. I tell people to repeat that 5 to 10 times in a row and do that cycle when they wake up, middle of the day, before they go to bed. So start to just get your body in a healing place. The other thing I ask people to do is to journal at least one thing, ideally 3 to 5 things, write down that bring you joy or that you're thankful for, even in the midst of being unhealthy, feeling bad, having a recent bad diagnosis, whatever it may be, struggling with family members that are sick. Find something in your day that brings you joy or that you're thankful for and write it down, not just think about it. Science is really clear that helps to change brain chemistry. So before you make really serious decisions about healthcare, we don't want to be rash, we don't want to pick the wrong person, we don't want to do that. Do those things for a day or 2 and kind of get yourself in the right mindset. Then I would say there is some research that has to be done. We're not all created equally. There are people out there, unfortunately, that claim functional integrative medicine that I don't think are qualified. And so you need to do some research to the best of your ability, look for certified doctors, try to get, word of mouth, find out if anybody's gone, somebody that you trust, visit their website and see if it resonates with you, if they speak to, speak your language, and then call the office, see who you can speak to. You'll get, I tell my staff, the first experience my patients have should be a healing one. So if you're not going to be a healing person when you answer the phone, you don't work here. So again, you get a sense of what that experience, maybe that's okay for some people. If you call the office and that feels like a good fit in that interaction, then, and everything else looks good. So pay attention, but be in this place of, I know you don't feel good. I know you're sick, and that's why you're seeking us out. But be in a place where you can feel like you can make a decision. It doesn't have to take you a month to get there, but just a day or 2 to settle and research as best as you can. That's what I would say is and then trust your inner being, trust your gut, trust, I would say pray, whatever that is for your own self that gives you that peace that you feel like it's the right step to move forward. But definitely seek someone who speaks this language so that you can get the answers that you really want, because you're not going to find it. And it's not because they don't want to. Your doctor wants to help you, but they're not trained to do it this way. So
I think that has to be reiterated and emphasized. Right. Doctors in general are not trained in this way of thinking. Right. We had to learn it I mean, it looks very logical now when you think about it. Why didn't I ask? But that was the cause of our frustration in the classical medical system. Is like we knew something was missing, but we just didn't know what.
Right.
Yeah. And the other thing, since people are going to do the research like you and I all did, what is a good book that they can read that will really open their mind? It could be a mindset book. It doesn't have to be a health book. Is there something that, because you've always recommended books from what I can remember, what would your go-to book be?
So I have a favorite book for everything because everybody struggles with difficulty, difficult feelings, difficult relationships. And probably my most favorite book to recommend to all my patients and friends and everybody else is a book by a dear friend called 90 Seconds to a Life You Love by Dr. Joan Rosenberg. And it is one of the most powerful books on changing the way you think and process, and really a way to develop resiliency in the midst of difficulty. And that doesn't take long, right? 90 seconds.
Yeah.
Anybody can do anything for 90 seconds, but it's a really powerful, we get stuck in our heads, right? And so part of it is we've got to change our mindset in order to become healthy. We can fix lots of numbers and lots of things on paper and lots of things, but if we don't fix that piece, we'll never get well. So that would probably be my favorite go-to book.
Awesome. Yeah, I think you gave me that recommendation once when I told you about all my various passions that I had.
Yes.
So thank you so much. This has been wonderful. I really appreciate your time. And
Absolutely. Thank you so much for having me. This has been fun.